Hi, welcome to our telehealth medicine information video. I'm Garvin and this video is on Prolutex, or in some countries the brand is Lubion. So Prolutex dose for adults is a once daily injection of the 25 milligram and usually until 12 weeks of confirmed pregnancy. As the indications for Lubion are restricted to women of childbearing age, the dosage recommendations for children and the elderly are not appropriate. Lubion is given by subcutaneous or intramuscular injection. So for special populations, so the elderly, there's no clinical data have been collected in patients over the age of 65. In renal and hepatic impairment, there's no experience with the use of Lubion in patients with impaired liver or renal function. And the paediatric population, the safety and efficacy of Lubion in children under 18 has not been established. There is no relevant use of Lubion in this population in the indication for luteal support as part of Assisted Reproductive Technology treatment program in fertile women. So the method of administration: treatment with Lubion should be initiated under the supervision of a doctor experienced in the treatment of fertility problems. Lubion is intended for intramuscular or subcutaneous administration. Intramuscular administration, so you choose an appropriate area. So the quadriceps of the right or left thigh, you swab proposed area, insert a deep injection, the needle at a 90-degree angle, and the product should be injected slowly to minimize local tissue damage. Subcutaneous injection, you choose an appropriate area, the front of the thigh or lower abdomen, you swab, pinch the skin firmly together and insert the needle at a 45 to 90-degree angle. The product should be injected slowly to minimize local tissue damage. Contraindications: Lubion should not be used in individuals with any of the following conditions. So hypersensitivity to progesterone or to any of the excipients, undiagnosed vaginal bleeding, known missed abortion or ectopic pregnancy, severe hepatic dysfunction or disease, known or suspected breast or genital tract cancer, active arterial or venous thromboembolism or severe thrombophlebotitis or a history of these events, porphyria, a history of idiopathic jaundice and severe pruritus or pemphigoid gestations during pregnancy. So special warnings and precautions for use. Lubion should be discontinued if any of the following conditions are suspected: myocardial infarction, cerebrovascular disorders, arterial or venous thromboembolism, thrombophlebotitis or retinal thrombosis. Caution is indicated in patients with mild to moderate hepatic dysfunction. Patients with a history of depression need to be closely observed. Consider discontinuation if symptoms worsen. Because progesterone may cause some degree of fluid retention, conditions that might be influenced by this factor, for example, epilepsy, migraine, asthma, cardiac or renal dysfunction, require careful observation. A decrease in insulin sensitivity and thereby in glucose tolerance has been observed in a small number of patients on estrogen-progestogen combination drugs. The mechanism of this decrease is not known. For this reason, diabetic patients should be carefully observed while receiving progesterone therapy. Sex steroid use may also increase the risk of retinal vascular lesions. So to prevent these complications, caution is to be taken in users over 35 years of age, in smokers and in those with risk factors for atherosclerosis. You should be terminated in case of transient ischemic events, appearance of sudden severe headaches, or vision impairments related to papillary edema or retinal hemorrhage. Abrupt continuation of progesterone dosage may cause increased anxiety, moodiness, and increased sensibility to seizures. Before starting treatment with Lubion, the patient and her partner should be assessed by a doctor for causes of infertility or pregnancy complications, interaction with other medicinal products, and other forms of interaction. So drugs known to induce the hepatic cytochrome P450 system, so carbamazepine, phenobarbital, phenytoin, or St. John's wort, the herbal product, may increase the elimination rate and thereby decrease the bioavailability of progesterone. In contrast, ketoconazole and other inhibitors of cytochrome P450 may decrease elimination rate and thereby increase the bioavailability of progesterone. Since progesterone can influence diabetic control, an adjustment in antidiabetic dosage could be required. Progestogens may inhibit cyclosporin metabolism, leading to increased plasma cyclosporin concentrations and a risk of toxicity. The effect of concomitant injectable products on the exposure of progesterone from Lubion has not been assessed. Concomitant use with other drugs is not recommended. Fertility, pregnancy and lactation. So fertility, Lubion is used in the treatment of some forms of infertility. For pregnancy, Lubion is indicated for luteal support as part of an assisted reproductive technology treatment program for infertile women. There is limited and inconclusive data on the risk of congenital anomalies, including genital abnormalities in male or female infants following intrauterine exposure during pregnancy. The rates of congenital anomalies, spontaneous abortion and ectopic pregnancies observed during the clinical trial were comparable with the event rate described in the general population. Although the total exposure is too low to allow conclusions to be drawn. Regarding breastfeeding, progesterone is excreted in human milk and Lubion should not be used during breastfeeding. Effects on ability to drive and use machines. So Lubion has minor or moderate influence on the ability to drive and operate machinery. Progesterone may cause drowsiness or dizziness. Therefore, caution is advised in drivers and those operating machinery. Special precautions for storage. So store the product below 25 degrees. Do not refrigerate or freeze the product and store it in its original package in order to protect from light. So side effects, pain and swelling at the injection site, breast tenderness, headache, weight gain or weight loss, acne, nausea, increased body or facial hair, loss of scalp hair, drowsiness or dizziness. Tell your doctor right away if you have serious side effects from progesterone injection, including unusual vaginal bleeding or discharge, breakthrough bleeding or spotting, stopped menstrual periods, breast lumps, swelling of the ankles or feet, mental mood changes, so for example depression or nervousness, dark patches on the skin or face, frequent or painful urination or dark urine. So breastfeeding and pregnancy, progesterone injection is not recommended for use during pregnancy because it may harm the fetus, especially during the first 4 months of pregnancy. If you become pregnant or think you may be pregnant, tell your doctor. This drug passes into breast milk, as I've said already, so consult your doctor before breastfeeding. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.